Hi, Amy.
Hi.
I have the distinct pleasure of talking with you today about the container resource. You teach about it in basic training and you also teach about it in Reboot, your online course. I know that a lot of people know about container, but I think you might have some particularly pertinent things to say about what it's really used for, when it's used, and in particular, your work with kiddos. And maybe I should back up. I'm Bonnie Michelson from EMDR and Beyond. This is Amy Terrell, our clinical director, basic trainer, and trainer for Agate Institute with Ana Gomez. And so we are talking about the container resource. So I know that it's been around a long time. I tried to find who originated the container resource. The only reference I've seen is on Roy Kiesling's material, from which you are teaching Reboot, where he says it was adapted from Landry Wildman, and I couldn't find any other documentation. I do know through the years that excellent EMDR clinicians have had variations of a script for the container, often following the same script that Shapiro originally developed for Safe Place. So I think there's some additional ways and maybe some reminders for use of container that you can share. So I'm glad we have a time to talk together. I would like to ask you first, what really is the container resource? What's the purpose of it? How would you define it?
So I would say overall, you can think of the container as a state change resource, just like Safe Places, but it has additional uh, possibilities and qualities with it. So
Okay.
um, the container is something that we use in EMDR therapy to help a client set something aside until they're ready to work on it.
Mm,
So, like early on in your work, when you're still in phase one and phase two, and you're doing history taking and preparation with a client, and maybe you notice that they share a little bit regarding their history and become very emotionally activated, and you're a little bit worried about their window of tolerance and getting them back to a regulated state before they leave your office. So having the resource of container is something that can be helpful in those times for the client. And then also in their everyday life. If
mm,
they experience, for example, triggers related to a traumatic event, and they are needing to be able to set something aside in order to get back to work or taking care of the kids or whatever is part of their day. Also, we use container in EMDR during the processing stage at different times.
mhm, mhm.
So I feel like I'm getting ahead of myself there, though.
That's all right. I mean, there's so many different ways, and so I'm just going to ask questions as it flows, and you just talk as it flows too. Because I was thinking, okay, so a container is a way that you set aside things you're not ready to work on, and things can be entire events. It could be an emotion, like anger. Okay, I got a lot of emotions I need to deal with, but I'm not ready to deal with. I mean, it could be a lot of different things that you could set aside. So, is that how you explain it to a client? And what about those clients who are already masters at setting aside? So, first, what do you say to clients? And secondly,
Okay, so I usually say to clients that a container is a place where you can set aside upsetting or disturbing things until you're ready to work on them. And then I might go, depending on the age of the client. So if I was working with an adult client, I would probably say something like, um, if something comes up when you're at work, that's reminding you of a difficult thing you've been through, like even, for example, a disagreement that you had with your partner, that you can set it aside until it's the right time to work on it. And
hmm,
sometimes that will just be at a different point in your everyday life. And sometimes it might be bigger things that come into your mind that we will save for our time together to work on those things. And so you can set it aside until you're in therapy and ready to take it out and work on it.
That could sound with your words like an easy thing to do, but we know that people who didn't get good enough nurturing and protection didn't get an opportunity to learn how to do that. I mean, they may have grown up with parents who let whatever emotion they were having rule the day. And so, among other client histories, those would be types that would have real difficulty. I threw in a question about people who might be too good at it.
Yeah.
They are very good at compartmentalizing. Is this still a good resource for them, or would you use something else?
So I would say that one thing I try to help clients with is understanding the difference between um, the kind of dissociative way that we set something aside and don't see it and don't feel it versus mindfully being in control of taking this thing that keeps coming to my mind and purposefully thinking about it going into that visualization of a container and knowing I'm not just brushing this aside, I'm not just sticking my head in the sand. I'm going to visit this in the setting that's going to be the most helpful to visit it. And I
Makes
tend
a
to
lot
talk,
of sense. Hmm.
yeah, and I tend to talk to clients about, we do talk in EMDR a lot about managing big emotions, which is really crucial to work with, especially with people who didn't have the benefit of growing up in a family of origin that was able to promote the regulation of emotions. And that part of what we want to do is we want to learn how to feel our feelings in the moment and not necessarily have to set things aside, but that sometimes we may experience such a flood of big emotion connected to something
Mm.
that it's difficult to go about our everyday life. And most of us, regardless of if we have a significant trauma history or not, can relate to having intrusive thoughts about something we're worried about or
Mhm.
concerned about, or if we've been through trauma, being reminded of that trauma. And then the big emotions that can come with that, and how it can make it very difficult to complete our jobs or be in the present moment. And so the
Mm.
container is different than other strategies in that we are noticing what's coming up. And that's part of the work that we do with the client is about noticing when you're feeling that big feeling that's starting to make it difficult to be regulated enough to do what you need to do. And then allowing whatever needs to go into the container and knowing that it's going to stay put until you decide to work on it. And so, in some ways, too, what we're doing is helping a client to feel empowered. In
Yes.
I don't have to always visit every trigger that comes to mind. And I just want to say a little side, which is I am not talking about when someone is going into hyper or hypo arousal, because that's different. But if they still are having the ability to use that good prefrontal cortex and the thinking to use container, then um, that is the time that it's ideal is when we're not totally in like a hyper aroused state, because that's kind of different. People need to breathe. They get into hypo, they need to move. But in general, at that kind of starting point where a lot of people will begin to ruminate about something or have excessive worry, the container is an ideal resource for that.
Mm.
And then Bonnie, you asked about what about people who are really good at it. So one thing I have found is much of the time in my own clinical practice, when container doesn't seem to be successful at first. So when a client is saying, I don't really know why, it's usually because they already do it. They already have a way of setting things aside. Sometimes it is not necessary, it's adaptive, but not necessarily the healthiest thing, because it might be part of avoidance or even
Mhm.
dissociation or this disconnect and numbing. So I'll say to them that that what I think is, this doesn't seem like a very helpful resource because you already know how to do this. You're already really good at knowing how to set something aside. What might be a little bit different about this container is that we're not just setting it aside never to visit it again. We're instead doing that little bit of work that helps us get to the point where we're ready to visit difficult things we've been through, by acknowledging that we're feeling a certain way and that it's not a moment in time in our life where it's the best opportunity to work on it. So instead, we're mindfully setting it aside, knowing that we will revisit it at some point. And so just like creating that distinction. And then sometimes I'll just say to clients, if they're really struggling because they're already someone that does that, I will say, can we put a name to what you already do? And maybe just modify that a bit with the mindfulness of, it's a temporary set aside and I'm noticing while I do it, um, so that I'm aware that I can bring it up later in therapy or at the right moment in my life to think
Mhm.
about it.
Well, I heard several things that make lots of sense to me about the process. You said it was empowering, and many times as you've talked about purposeful, making a choice, and that's not what trauma survivors have had. They didn't have a
Mhm.
choice about the trauma, and
Right.
so immediately it's working on that part of their history, and that's so valuable. And then the people who will say, well, I'm already good at it. um, I had not heard what you just shared. That's another valuable tip to say, well, what do you use now? I've done it with Peaceful Place, but I
Yeah.
hadn't done it with Container. And so, wow, a Peaceful Place, if somebody couldn't think of something like, well, what do you do when you're upset? Well, I go for a run. Well, we can install that.
Yeah.
So thanks for elaborating on that. I love learning new things. So I wanted to ask then examples of some containers, both for adults and then for children. Um, I'll stop there and let you talk
Yeah.
about that.
So, when we are introducing this idea to clients, we invite them to, we kind of describe what a container is, that it's large enough to contain whatever you might need to put in it, that it's nice enough inside that whatever goes in will stay,
Mhm.
and that it has a lock, and that you are the one who can open it. And so then the client gets to decide, with their own imagination and really their own memories, what their container will be. Something that never ceases to amaze me is how frequently people choose Tupperware.
It's something
This
that's
is,
messing with your volume. Can you say that again?
oh, darn.
And
Uh,
your picture was moving. So,
Oh, something that never ceases to amaze me is how people so frequently pick Tupperware. And it's always the kind that has, you poke in the middle and it
burp.
unseals.
Yeah, right.
I love that. So yeah, people have a variety. I've had a lot of clients that pick Tupperware, and then sometimes, clients will say it's a vault in the middle of the sea, and there's chains around it, and it goes down in the middle of the ocean, and only I know where it is. So you can have a variety of, you know, anything really that could contain something,
Mhm.
and then there's uh, with teenagers, a lot of times they might be more tech oriented. So they might talk about, a virtual space and it being in an encrypted way in the cloud. So, yeah, there's a whole variety, just to how imaginative the client is or what their experiences are with containers like that, and they get to decide. And with
That's
kids,
fun.
yeah, with kids, very often we're wanting to create a real container with them. And that process is allowing them to choose the type of container they'd like to use. Um, and then they can decorate that container. At my office, I use little like wooden trunks. And then I also just keep little boxes and bags and things like that, gift sacks, and let them choose. And then they can decorate the outside. And we talk about um, the purpose of the container and how, they can open it up and allow whatever needs to go in there. And um, yeah, there's some things that we want to consider with kids is we don't something I learned from Ana Gomez is we don't necessarily want them taking their containers home unless
Mhm.
we've talked with parents about how to use that, because we would never want, for example, like a sibling to find the container and make fun of the client. That would pretty much ruin the whole
You bet.
purpose of container.
Mhm.
So you always want to make sure that the parent has a good understanding of the privacy needed for the container and where to put it if it is something that's going home. But if it's not going home, what you're saying to the child is, this is a container to put any of the, yucky or scary thoughts that come to your mind. And we can keep it in the container until you're ready to talk about it. And so then we just keep it in the office and their container is there. And then we tell them that it also exists in their mind.
Mhm.
And
Oh.
whenever they need to, they can pull the container out in their mind and, put things away.
Mhm. I had a few adult clients who made a real container, and decided to leave it in my office.
So, yeah.
Again, great new tip to me. I never thought of telling them that they had it in their mind too. And it's such a strong resource for most people, it would seem to me. I would bet it's the most common one that's used by therapists, and most clients seem to be able to relate. I do know that I get questions about how do you deal with someone who's not imaginative, who is just too concrete. Well, you've already said some of those people might be good ones to have a actual container, but are there other ways that you help someone who's resistant or just isn't visual? It just doesn't resonate with them. Would you just not use a container or teach them another way to set aside?
Well, I am probably a little more persistent with the container than about any other resource. And that's because,
I agree. Mhm.
yeah, I like to use the container to help people with containment at the end of
Yes,
EMDR therapy sessions.
right.
And I also think that many people benefit from use of the continuum, which is taught in the Kiesling model.
Right.
And
That you talk
also,
about in Reboot and you
yeah.
talk about in Basic. Mhm.
And then also, if anyone is using other variations from standard, like a recent events protocol or Shapiro's EMD, then it is nice to have the
Mhm.
container. Otherwise, you're having to do a lot of explaining about how to set something aside. Where if you have container with your client. And this is what I explain to clients that maybe don't think that it's super helpful is that for the ones we talked about who are already good at it, is I'll just add, being able to name the thing
Mhm.
you can do when you're setting things aside will help us have a shared language.
Mhm.
Instead of always having to go into detail about what we mean about that, I can say to you, is there anything that came up that you'd like to allow to go into your container? And it's an easy way of me saying, distressing things, things we're not working on right now. You can allow that to go in your container and you know what I'm talking about. And so, because of that, and because we do use it regularly when we get into the processing work with the MDR, it's nice to have a container. So then usually people will be on board with it
Good.
and create one. Occasionally, of course, we can't, we would never want to try to make people have a
Exactly.
resource they're not interested in. But sometimes if we explain it with a little more depth and help them see how it can be beneficial to them, then they would be more on board with doing that. So if I do have a client that's just having trouble with the visualization end, one thing I do is I have a um, trunk at my office that is wooden, and it's, like medium size. And so when I'm describing it, I will sometimes pull that out and say, here's what I mean. It's a
Mhm.
container, it has a lid, you open it up, you can put things in it, you can close the lid, and you can see I can set this aside until I'm ready to pull it out again and open it up. And for many clients, that will be all they needed to hear. And then they will say, sometimes they'll say, in my mind, it's that right here in your office.
Uh-huh.
And that's great. That works. Other times they will say, okay, now I'm thinking about, a larger sort of treasure chest, or they have then their own idea of container.
Mhm.
And sometimes I think too, when clients are struggling with visualization, we want to understand that more. So, is it that they're really having trouble with the visualization and the imaginary piece of that? And that's an important thing for me to take note of, because sometimes that's pointing to more significant adverse experiences in
Mhm.
childhood. We
Mhm.
know that one of the first things children do in traumatic situations is they stop playing. And so, if I don't already know the client's early history, that's kind of, something that I'm curious about now in my mind. And of course, there can be other reasons why people struggle with, visualization and the kind of imagination component.
Mhm.
But if it's so, that's why I guess what I'm saying is we want to understand the why. We
Mhm.
want to understand why it's a challenge. Is it a challenge because this seems like it won't be helpful? Is it a challenge because they have trouble with visualization and imagination? Or is it a challenge in that they don't think it'll work? And so all of those different things would have a different way. We would have a different way of handling it.
That's excellent. What an outline. Well put. I think um, when I think about clients and container, I would agree with you that has seemed vital to me as a therapist and consultant and trainer that almost everybody have a container, or if not that, and you push for it, at least some way to set things aside. And so I think you're saying keep going. Uh, if
Oh,
you believe you can get a container with a client, you're more likely to, and explain the whys, plus it's diagnostic. The other thought I had is that it's kind of not in the forefront of our EMDR work, but it's always there with skilled therapists that there's differences in cultural background,
mhm.
differences in gender, age.
Sure. Yeah.
Um,
Yeah.
I mean, whether in your immediate family, whether you were considered out to lunch if you were imaginative or if that was rewarded. I mean, I
Yeah.
think of cultural identity and how broad that is. And
Absolutely.
not that we shouldn't have that be a part of our work at all times, but the why also could be, well, this is what happened to me when or in our culture, we don't XYZ.
Mhm.
And I know that anytime we look at cultural differences, we can't stereotype that all men do or all women. We know that's not true, but I hear that in the background of your very skillful answers. So I'm going to ask you another question. I would like to know some ways where you can containers just didn't work. If and maybe there aren't any. You're such a fan, you maybe get them to a place where
Well,
they see it.
definitely, with any therapy,
Yeah,
your buy-in as the therapist makes a huge difference
absolutely,
in how successful the client believes that therapy is.
exactly. Yeah.
Um, but So one thing that can happen is people who have a more complex trauma history, they can get a container, but then they may experience that they feel very challenged with the container working. Um,
Mhm.
that they feel things come out of the container, they don't stay put, that it's too full, that kind of thing. And so, one thing I like to do, again, from that perspective of of helping the client find within themselves their internal locus of control, to say, you control everything about the container.
Mhm.
It happens in your mind. And so, what does it need? You can expand it. It could, have a magical component where it automatically just would get as large as it needs to be, where there's a seal on it that only you can undo, and normalize this. It takes practice. The more you practice it, the more effective it will be. And that's why when we're first starting out the cueing with disturbance, which is part of the script, and basically inviting the client to put something in the container that is a low level disturbance, like a 1 or a 2.
Yes.
Um, if they have trouble with that, then we want to cue with neutral. So just think about putting something in your container or allowing something to go in your container that um, you don't really have a lot of feelings about in general, just something you do every day. And then allow that to go into your container. And now tell me what you notice. So sometimes, in the introduction is where we'll notice a challenge with container, like when we're doing the cueing with disturbance. And then we have to dial it back and normalize and maybe try out cueing with neutral. Another thing that can happen is that the client feels that the container isn't really strong, and all of this, of course, is often, and I'm not saying that this is the absolute diagnostic tool. Of course, it's just one piece of everything else, but we're curious about you know how much is there for the client, that this doesn't feel like it can be that it doesn't feel it can be secured in the container.
Mhm.
And also, we can see this with people who have been through a lot of difficult things because of how the brain changes in terms of noticing more of the negative, or more of something that is just a little bit off, or being more attuned to things in that way as a way of surviving. And so then they may report uh, more kind of negative things about the container. And again, if it needs to be modified in some way, we're doing that. Otherwise, we're just doing our best to help the client learn how to practice it.
Mhm.
You can do the extended resourcing that Kiesling has in his model, where you are rescripting and rehearsing. That's going to increase the client's capacity to remember to use it.
Mhm.
But in terms of, I'm trying to think, because I think your question was when it just doesn't work.
Yeah.
So I I have rarely had where a client, after the additional explanation of it or showing them one, that they can't, or they say there's no way that I can create a container. Um, that has not really been an experience. I mean, I may have had a client that said that, and I know that if that ever happened and they felt adamant they could not have a container, then I would ask them, about the ability to set things aside. And if they felt that they did have that ability, I would ask them if we could name it.
Mhm.
And then I would still go through the resourcing.
You are persistent, and it makes sense to me. So I want to label a couple of things that you talked about. I think the name links it into their neural pathway. So again,
Yes.
you were saying it's so more accessible to them, because not just in the therapy office, but at home, it's much easier to think, oh, what's my container than it is now. What did Amy say about setting things aside?
Right.
So it
Yeah.
links that. And then Kiesling's extended resourcing, rescript and rehearse. When could you have used the container? When would you like to?
Mhm.
I think is another excellent example of how when you practice it in the office, then people are more likely to actually remember to use it. And I know you teach more about it in Reboot, so I won't go further in that direction, but that's a great explanation for how it works. I also love the client centeredness because I think as I see the growth in the EMDR community through the years, I think we're figuring out some of the things we felt we had to tell our clients, we are now asking them. And some,
Yes.
maybe all through the years, people ask the clients about what's your
Mhm.
container like. I'm not saying in this specific example, but I think when the container doesn't work, it would have been nice for me to have considered sooner why and asking more about it. And that has to do with my own level of confidence as a therapist. Now, I know in training and with consultees, we have to do the same process to try to figure out why didn't the container work? And you hinted
Yes.
at, sometimes it's really hard for us as therapists to give away stuff that doesn't work for us. So it may be
Oh, yeah.
somebody that doesn't do that well, or they don't understand the process, or some of the, it's an art. And that's why you and I can more easily talk about the things we've learned sometimes the hard way. So I know we can, if a little kid has this was from a consultee, she did a container with a little kid and he picked, he was 8 years old and he picked a coffee can. And then he came back the next week and he really understood the purpose of container because he said to his therapist, um, some leaked out. So she didn't tell
Oh.
him what to do. She said, well, what do you think you need? And
Mhm.
he thought duct tape would do it, and it did. So I have that example in the post that will go with our discussion. But those
Yeah.
are my examples. What are some examples from you with clients about containers?
So I just really appreciate the example that you shared because it is so aligned with what Shapiro taught us
Mhm.
about the AIP model that clients have within themselves what they need. And so I love when I hear EMDR therapists, really aligning with that and helping their clients to connect with it. So, some examples of containers that I have heard in therapy.
Mhm.
Oh, okay. So I have heard like the Tupperware is common, and people will use things like trunks and vaults, and sometimes it gets imaginative or high tech in that only the container can be opened with their retina scan. So I know they're watching some of the same movies I like. And sometimes kids, they'll use a lot of Harry Potter references. Well, actually, they're not really kids now, they're in their 20s, right, if they're
That's
using
right.
and
However, it is generational in regard to the Tupperware because I grew up with my mom going to Tupperware parties, got stuff
yeah.
as gifts, and but I don't know that people do that much anymore in that same way. So, and the
Mhm.
millennials, why wouldn't they have examples of their world that is much more online and the I generation? So that's really cool.
Yeah. Yeah. So those are, typical examples of containers that I've heard over the years.
Mhm.
It's always kind of, interesting too to see what people will say.
Yes, I was
Mhm.
reflecting back kind of to what you had talked about earlier, that in training, when we're teaching container, one of the most common reasons that it doesn't work is that people choose something they think is a 3 or less, and it's not a 3 or less. First of
Oh,
all, they're just getting introduced to that scale. So it's just like with our clients that we've just told them 0 is doesn't bother you, 10 is the most it can, and then to try to remember and be familiar with that in regard to developing the container, that's challenging to
it
do.
is. It is. And I think that the reason sometimes, and you said it earlier, sometimes we'd say a little bit of resourcing in some way is diagnostic,
Yes.
not that it's the full assessment, but it's a component of. And
Mhm.
so it's common for people who've had complex trauma that their mind will go to something that does tend to be higher on the SUD scale.
Mhm.
And a lot of times that's because it's just right below the surface for them. And so,
Right.
or it's that so much is connected.
Mhm.
They might think that thinking about, um, you know, when their aunt calls, that that's a minor disturbance. But if it's actually connected to feeling some sort of uh, undue or over responsibility, that's the theme song of their life, then that thing is actually a much higher disturbance. And sometimes it's hard for people to separate out what's all connected and what isn't.
I think one of the examples that came up in a training was someone who reported to me the next day after we had that practice that the container didn't work for her. And so I asked, well, what did you think about? And she had thought about something she heard on the news before she left home. And so I'm so glad this happened to me after I'd been doing EMDR for lots of years, because I so knew there had to be some emotional charge to that, the thing she chose that she didn't realize. I just said, think about it. Do you think it connects at all with your trauma? And of course, I didn't know what her trauma is, nor was I asking her to tell me in training. I just said, do you think it's connected? And she first said, oh, no, there's nothing about that story, which I didn't even know what the story was. But she said, there's nothing about that story that's related to my trauma. I said, check again here, because she answered real quick from here.
Mm-hmm.
And she quickly got that link and she said, oh my gosh, it is. So then
Yeah.
we talked about
Oh,
how
goodness.
to pick out uh, a, a little thing that is suds or less. And it's a crapshoot in some ways, because we have all these neural pathways that if we knew them all, we wouldn't need EMDR.
Yeah,
When I
exactly.
get EMDR, I'm still going, my gosh, this stuff really works. And I've been doing it for years.
Yes.
So we don't have it all connected. But I thought it was such a good message for her, because it helped her know just how close that memory was. And at the same time, the teaching point is a SUDS of 3 or less, you may need to help your client think of something that fits. There's
Mhm.
a video that you show, I don't know where it's showing up now, with the young woman who picks Starbucks or something, as to not being in line at Starbucks, and you knew her well enough to say, I don't know if that's a 3 or less. That could get you pretty distressed. So
Yes.
I assume too, it's helpful to know your clients enough to know you can guide them sometimes and what really is a 3 or less.
Right. And sometimes giving, examples can be helpful.
Which would you
So,
use
like,
some more now?
yeah. So, saying to a client, like for me, a disturbance of a 1 or a 2 on that scale of 0 to 10, where 0 is neutral or no disturbance, and 10 is the most disturbing thing you can imagine. For me, a 1 or a 2 is like standing in line, going to the post office and having to stand in line,
Hmm.
or being at the mall and standing in line to pay for something, or a minor disturbance might be my dog barking when people walk by. So it's not something that's connected probably to bigger things. Who knows? Now, I've been an EMDR therapist long enough, like you, Bonnie, that whenever I'm like regularly saying something, I'm like, well, it probably is connected somehow, but it's not very disturbing, at least.
Right. Yes. We learn to be cautious about that. Well, I learned also the hard way as a beginning basic trainer that I did need to explain container more, just as you have been doing, and as hopefully we'll do in our post that will go with this conversation. Because I had people, some people try to put their whole trauma network in a
Mhm.
container. Uh,
Yeah.
Well, no wonder it didn't work. But that was a lack of clarity. Again, I believe our field is getting more and more precise through
Mhm.
research, through expertise, and to really name better what we're talking about and be much clearer about why we're doing what we're doing. So I think that's resulting in better therapy for kids and adults, and
Mhm.
I'm excited about that.
Yeah, it is exciting.
Yeah. Anything else that you'd want to add as a final thought, or I'm sure
Mm,
you have more to say, but anything that would seem vital before we wrap up?
I just think if that one thing to remember is we aren't just limited to that moment in time trying to help the client manage everything that could come up with container. I
Mm,
see that a lot in consultation
mm,
where, we start out and we run into the things that could come up for people. And so then we start trying to prevent it from happening to the next client. And then we get really wordy about it and everything. And so just remember that we can always work with the client right there where they are. And often we can help them make any changes or modifications they need to their container over time instead of trying to like prevent anything from happening, which is something I did too at one point.
mhm.
And so instead, just allowing for what does come up for the client to come up, and then together doing what you so beautifully shared that EMDR therapist did with asking, well, what is it that you think your container needs?
Mm.
What would help with that? And then also remember that even though I talked here about being a little more persistent with container than other resources, just because I find it so helpful to have that shared understanding for use of the continuum and other types of techniques with processing. Um, if a resource, any resource, continues to not be successful for the client, we of course have to find a different resource. So
Okay,
I
well,
have to say that since I said that I would keep finding a way.
yeah, yes, didn't want, again, we are not talking about rigidity. You're
Yes.
talking about the value and power of the container, which is part of why I thought it was worth a conversation and a post. And so I appreciate your contribution to that.